The first thing I want to do, I want to make this like a threat assessment. So if you were coming into the White House to brief my office or the president himself, how do you see the chessboard first in terms of what the risks are and how we're handling that?
So as I see it, we've gotten locked into some fundamental policy positions that just don't make a whole lot of sense. And one of the core problems is that you really can't vaccinate your way out of an ongoing pandemic. You shouldn't really be doing that. You need to focus your strategy on protecting the people that are most vulnerable, providing alternative options for those that do get sick, and preparing for a protracted period where we're going to have virus circulation. Now that it's fully in the population, we can't avoid that.
All right, here's the thing I want to focus on, because you just said something that's the critical point here. You said that you can't vaccinate your way out of this pandemic. Break that down for me. Why is that?
So it comes down to fundamentals of evolution and selection of viruses. Now that it's fully in the population, if you start vaccinating as we are and advocating that we have universal vaccination, what that's going to do is drive vaccine-resistant mutants. That's inevitable. That's just fundamental virology 1A. And as you do that...
Let me ask you this question, though, because the spin is just the opposite out there. It's saying that it's the unvaccinated people who are generating the mutants. Can you work through the biology of why that's exactly wrong?
Those are one of the fundamental lies, and I think it has to do with the scare tactics going on right now, because they're really all in thinking that they have to have universal vaccines. But it makes no sense to anybody that's had even basic genetics. What the virus will replicate in the unvaccinated as it would in any human population, but it won't evolve to escape the vaccines. It will evolve to escape the vaccines only in those that have been vaccinated, particularly when we have a leaky vaccine, which is what we have. All of these are leaky vaccines. They don't fully protect people from being infected and having the virus replicate, and they don't protect other people from being infected by those that have received the vaccine and been protected. What that means is that viruses that are able to survive in people that have been vaccinated are going to be more resistant to vaccines. And what we end up with is an arms race between us and the virus if we do this. Does that make sense?
It does. And so again, the important point here is that if you universally vaccinate into the teeth of the pandemic, what you're saying is that the virus will continually be able to outfox us, essentially,
Absolutely.
Through mutations.
Absolutely.
No question in your mind.
This is basic viral biology in evolution.
So that there's some optimal level of vaccinations, to your point, right? You're not saying don't vax at all.
No. So in the veterinary world, they don't vax at all, particularly in the Netherlands. They'll just kill the flock. Obviously, we can't kill the flock.
Do that. Yes, let's take that right off the table.
Exactly. But what we can do, because we have to be humanitarians, I'm a physician, right? We need to protect people. We need to protect the vulnerable. You need to target the vulnerable, but the vulnerable are actually a really small slice of the population. For instance, in all of the deaths, pediatric deaths, since the start of this, up to age 18, virtually every single one of those have had strong pre-existing conditions that set them up for death if they got infected. Those are the ones that should have been vaccinated in the children. In the elderly, we know that this goes exponential. The older you get, the higher your risk goes. Those people need to be vaccinated. The rest of the population, unless they are morbidly obese or they have genetic immunodeficiencies or vascular leak syndrome or some of these other risks that are known, they don't need to be vaccinated. That's just playing into the virus's game. Now, there are tools that could be used and deployed so that everybody would be able to predict their risk.
Before we go there, let me ask about, because people want to know this. Among the other people who may not need to be vaccinated might be people who have gotten the infection and have built up antibodies and T-cell immunities. But there's an interesting thing that the CDC just came out with in terms of a slide deck. Talk to me now and our listeners and viewers about the durability of the vaccine versus the durability of your natural antibodies, there seems to be a 6-month interval. This is not smallpox. This is not polio where you take the vaccine once and it's permanent. Why do we have this 6-month interval? What are the implications of that going forward?
So as you're pointing out, one of the bombshells in the recent leaked CDC slide deck is that the CDC believes that the natural immunity caused by infection only lasts for about 180 days, half a year. That happens to be exactly the length of time now that everybody is agreeing that the Pfizer vaccine is good for. That's why Pfizer's saying you're going to have to be revaccinated at 6 months, because the vaccine craps out, it stops being effective at 6 months. Why is that happening? Unknown. There's something about coronaviruses and the antigen, and the key antigen here is spike, and it must be something having to do with spike manipulating immune responses. It's unknown why this is. Usually vaccine responses are more durable, but in this case we have very potent vaccine technology being used, and yet the vaccine durability is not lasting beyond 6 months, and the same is true with the natural infection immunity.
Is it likely then, based on what you're saying, is that we're going to live with this for the rest of our lives and go through multiple cycles of vaccination?
That's been my opinion from the outset, is this is just like the natural cold virus, beta coronaviruses that we've all been exposed to many times. This is going to continue to circulate like flu. And what we need to do is to get it to be like flu. The natural course of virus infection when it moves into a new species like us is that over time it will become more infectious and less pathogenic. And I don't think that we've got any option.
And let me make a comment on that, because intuitively, and I remember talking to Doc Hatfield about this back in February 2020, he says that a truly successful virus, their goal, the virus's goal, is to spread as far and wide as possible. And in order to do that, they can't kill everybody outright. Like Ebola is not it's successful in that regard.
It's too hot. So
knowing what you know about virology, is that likely what's going to happen here?
Hatfield's dead on. It's not in the genetic interests of the virus for us to go to bed and not circulate and spread it to other people. So that's why in general, over time, it changes to become more infectious and less pathogenic. There's some signs that this could be happening now with Delta. Does that mean that's what's going to happen? The randomness of the mutations is hard to predict. But over time, that's what's likely to happen, is this will drive towards something that is more like an influenza or cold virus that just circulates in the population.
But if you vaccinate into a pandemic, does that increase the risk that you're going to get some mutations that might not go in that direction, that might be more dangerous? I mean,
it's going to increase the risk that you get mutations that are escaping vaccines. And so you're going to need more and more and more powerful vaccine technology. Why does that matter? When we eventually get to something like herd immunity, there will be kind of a truce with the virus, and the virus circulation will drop down until we have enough people born into the young, the pediatric cohort, and then it'll start circulating among the young. Okay, and that's the point where we need to be able to deploy a vaccine. That's why we have pediatric vaccines, because it's the new birth cohorts that fill up that glass of water to the point that the virus has enough that it can start replicating.
Are you saying it's inevitable that this will reach our young children?
It's already infecting our young children. Fortunately, it's not driving them into the hospital and death. There is
that likely to change based on what you know? Are children likely to...
I wouldn't say likely. So what you're asking is it likely to become more pathogenic in children?
Yes.
Is that the question?
Yeah, because it's been a blessing that it hasn't been.
In general, I doubt that there's an evolutionary driver, but you can't predict. This is a roll of the dice.
Would we agree that it's insane to vaccinate our children, our healthy children?
All over the world. I'm on podcasts and being contacted by docs all over the world. The evidence is quite clear. The risk that we now know associated with these vaccines in the pediatric cohort outweighs the potential benefits. It's upside down.
And what's the risks for the pediatric cohort in particular?
In particular, what we now know is official policy is we have these cardiotoxicities, pericarditis and myocarditis. That's not nothing. You're talking about long-term compromise of heart function in young people. We don't know about a whole lot of other risks, and there's many that are potential that appear to be in the data, but they're not yet officially identified.